Hello, everybody. Suzanne Conversing from Dawning Visions Hypnosis. I have a question for you, and that question is, are you working too hard for your bottom line? Many folks who run therapy practices find this to be true. And the reason for it is because if you're taking insurance, you're not going to be paid as much as maybe you would if you were able to charge what you're actually worth with self-paying patients. And if you're working in an agency, many times they underpay the folks who work there, especially in community practices that are nonprofit. When I was doing research for the subject matter that would be really important to you, there were quite a few people who had commented on the fact that they had to work a whole lot of hours because it was their billing hours that actually was the thing that kept the whole rest of the place running, meaning all the executives and all their bosses getting paid off of the billing that they did. And they were the worst paid of all and didn't really feel fair to them. So what do you do about this? Well, I would suggest that instead of doing sessions, you do programs. This can only be done if you are actually working with private pay clients, because private pay clients understand that if they're going to get their objectives for their therapy achieved, that perhaps it'd be better to pay for a program instead of doing weeklies. And what I've found, honestly, is that when I was offering weeklies, people would drop out left and right because they just were not committed. When they have to pay for a program, and even if they're paying in payments, they're more committed to the program because they realize the program's being offered because it can help them to solve their problem, which means you have to be able to help solve the person's problem, not just manage it endlessly forever. So it's a different sort of mindset, actually. And my clients actually appreciate it because I can help them as long as I do their work, because as you know, all we can do is facilitate it. We can't do the work for them. And after 20 years of working in hypnotism and neuro-linguistic programming, my clients, some of them who have written testimonials, which you can read on my website, dawningvisions.com, make it look like I walk on water. But it's really they who did the work that needed to be done. They had to have the hard conversations with the people in their lives that were causing chaos for them. And they had to be willing to do the things that their subconscious mind told us they needed to do, because that's where all the information comes from that I get in terms of how to help them transform their lives from doing self-harming behaviors based on self-harming thoughts to life-giving thoughts and behaviors so they can live into their compelling future, the things that they never were able to do that they truly wanted to do because their illness got in the way. So it's a whole different paradigm in terms of how to run your practice. And frankly, the people who understand the viability of it will jump at the chance to actually be well instead of just managing their symptoms. And they're okay paying for it because they want to be well. And those are the people you want to work with, as long as it's within your scope of care. Now, one of the things that I do know as a hypnotist and neuro-linguistic programmer who came into hypnotism and neuro-linguistic programming after working as a non-licensed counselor in conventional mental health is that there's different paradigms. Conventional mental health is about managing symptoms with therapy sessions and a lot of times medication. With hypnotism and neuro-linguistic programming, I'd prefer my clients not have any medications they're taking because I don't want the blended thinking that they have on psychotropics. And I want them to be invested in actual healing because it can be done for about 95% of my clients. Now I've gotten really good at screening out the people who I cannot help, and I cannot help people who have psychotic features or have a IQ of under 70 because they can't focus on what we're doing. The other group that we really cannot help are those who have personality disorders. I don't think personality disorders can be helped by anyone, frankly. Having been raised by a mother with borderline personality disorder who went to therapy for like my entire life, living in that household. So my first almost 18 years of life. But that being said, if you want to learn how to integrate hypnotism and linguistic programming into your healing protocol and actually be able to offer programs for $5,000 and up to the people who are self-paying, who know that their time is way more valuable than their money because they have plenty of money, by all means, check out my contact information down below and we can set up a free consultation call so you can see if that's something you'd like to do. That's all I have for you for today. As always, I thank you for spending your time with me. Till next time. Bye-bye all.